Good evening, aspirants. Good evening, sir.
Good evening.
So once you are ready, we can start. Okay.
Yeah, I'm ready. I'm starting.
Okay, start.
Good evening, everybody. So today we shall be mostly be dealing with the some basic topics of EDIC Part 1. So since the option was given to me regarding choosing the topic, so I chose some out of the box topics which are asked in the exam, but we generally we give less importance to it. So we shall be discussing a bit about brain death, post ROSC management of a patient in ICU, and a bit of an introduction like session to organ donation. So without further ado, we shall be starting the sessions. So suppose a patient has come to you, something 40-45 years old male patient has come to you post a road traffic accident, and the patient is of course in a coma. There are multiple injuries. There's a head injury also. You have done an MRI brain, and there is a diffuse injury with subarachnoid hemorrhage in ICH, etc. And it's been around 30 hours, and the family members want you to, give them a prognosis about the patient. So then the question arises. So because EDIC 1 is also like it moving towards a very clinical based. So it's almost always a case based question is being asked there from brain death. So then the question arises that how do you test for brain death, right? And once you have tested for brain death, then like how do you confirm the brain death? And in some situations where of course the apnea test and is not conclusive, then what do you do? So we shall be discussing those now. So firstly, we shall be discussing a bit about brain death. Yeah. So how do you define brain death? Brain death is mostly defined as that there should be an so there should be an underlying cause, irreversible brain injury to the CNS, right? Injury to the CNS, by CNS I mean brain. And there are some things which need to be ruled out. So hypothermia needs to be ruled out. Any electrolyte imbalance, gross electrolyte imbalance, any gross acid base thing like that is the met acidosis or severe metabolic alkalosis, those things. We also need to rule out any obviously sedatives and paralytic effects, any poisonings, right? And any other co-founders that can be dealt with case to basis. Co-founders that we want. So these things needs to be ruled out first. And questions are asked on the basis of this also, because in a stem there will be a 7-line stem, and somewhere it will be like mentioned that the core temperature was found to be 32.8 degrees Celsius. What do you do next? And one of the options will be something like wait for some time. So on the basis of that, you have to select that wait for some time option, because that will be like once the temperature needs to be normalized, right, between 34-35 degrees Celsius, then you can proceed for brain death testing. So once the underlying cause is there and these conditions have been ruled out, then you proceed for brain death testing. As I said, core temperature should be at least 35 degrees Celsius or more, and these things we have discussed. So once that is done, then we need to check out these reflexes. So the third point is absence of brainstem reflexes. What are the reflexes? For EDIC part 1 or part 2 even, just the names of the reflexes are good enough. Pupillary reflex, corneal, oculocephalic, vestibulo-ocular, and calf reflex. And which cranial nerves are involved, that also need to know. That's a bit theoretical, and that is very rarely asked in EDIC part 1. And how the reflexes are tested, those things are, are out of the scope of the exam, because it's an MCQ based exam, so nobody is going to ask you like that. And finally, we come to the apnea test. Most of the MCQs are from these ruling out these co-founders and the apnea test. So to perform the apnea test, the patient must have a normal blood pressure, normal body fluid content, and then almost a normal temperature. The PaCO2 should be between 40 to 50 and a satisfactory oxygenation. That is, the PO2 should be at least more than 65-70 range, and the saturation should be around 90%. Those type of things should be there. Again, to rule out the confounders. And once we do that, so what do? We put a cannula within the trachea and we supply oxygen at full rate, 10 to 12 liters per minute, and then we disconnect the ventilator. So once we disconnect the ventilator, we look for any spontaneous breaths of the patient, and if there is no spontaneous, breath, then of course the test is negative, and then we just put the patient back on the ventilator. But if there are no spontaneous breath, then what do you do?
যেটা করছেন ঠিক করছিল বস, ওর পিছনে সামনে কোনো ব্যথা হয় না। কেন মুখটা বন্ধ করতে পারিস না?
প্লিজ মিউট yourself.
দুপুরবেলা এই তেলটাই তুই মাখিস, সেজন্য সকালে আমি মুখ।
The minimum PaCO2, so after 10 minutes we check the PaCO2 level, and the minimum PaCO2 level should be more than 60 and more than 50 and more than 60. So why are they very different? Because of the difference in the guidelines, American guidelines, British guidelines, Canadian guidelines. I think for all practical purpose we are following the British guidelines because it's an European exam. So 50 should be good enough. If that is not in the option, we'll always use 60. This 20 millimeter marker rise from baseline is very important. Suppose PCO2 was 45 and then the delta PCO2 becomes 65. Then its PCO2 is already more than 60, so there is no confusion. But suppose PCO2 was 40 and then there is a rise of 20 and the baseline becomes 60. So then by this criteria, the apnea test is still it's a negative apnea test, right? So brainstem death testing is positive, although the PCO2 is 60, only 60. So this is about the brainstem death, and these values are asked: what is the normal, what is the PCO2 level, and this delta PCO2 change. These things are asked in the exam. These are all MCQs. Now suppose the brainstem death testing is negative, or you could not do the brainstem death testing because you had to early terminate. What do you mean by early termination of the brainstem death testing? The patient became hemodynamically unstable or the saturation dropped below 80%. So you had to cancel the brainstem death testing. So then what do you need to do? You need to do the ancillary tests of brainstem death. So what are the ancillary tests? One is the EEG. The second one is the MR angio of the brain. The third one is a transcranial Doppler, or you can also do the CT angio, of course. So these are some of the ancillary testings of brainstem death. So EEG, MR angio, CT angio, transcranial Doppler, and these tests are only to be done if the apnea test you cannot do or is inconclusive. Okay, so this was about brainstem death. That is how to conduct the brainstem death testing. This is very commonly asked in the exam. Lots of MCQs are available. There can be asked, and just a minute. Yeah, lots of MCQs can be asked from these factors which need to be ruled out. The temperatures, which is an exam favorite, the core body temperature thing. Then the brainstem reflexes you need to rule out, and of course the apnea test, and finally the ancillary test of brainstem death.